Now you've mastered the basics, this is all about advancing your fitness and health journey. If you already mastered the basics, like the beginning level strength and balance assessments, this is going to be the next step. Think about shifting from your general fitness advice to precise training. Advanced baseline measurements are like having a GPS for your health. They provide detailed, actionable data to refine your strategies, maximize your potential for aging gracefully. These tests allows you to personalize your health. Your results will reveal where you are excelling and where you need to have more attentional focus. This kind of targeted approach ensures that every step of you take are aligned with your specific needs. No more guessing, just clear data decisions to help you age in the healthiest way possible. And this is why you used your week one material. What do you want to accomplish for the rest of your life? This is going to also help guide your training program. For your homework, I encourage you to try to do some of these tests on your own. If any of these measurements seem intimidating or unfamiliar, don't worry. we will be doing the beginning versions of these ones in our week 3 session. But if you want to have professional guidance and have any specific concerns, we can involve your doctor, get an order for physical therapy, so I can safely guide you through the process, get the results, and guide you through developing your program for you. Remember, the goal is to empower you with tools and knowledge, not to overwhelm you. I do recommend Peter Tia has great podcasts from the drive. Episodes 307 to 206 are focusing on baseline measurements and trying to guide you for exercise plan and reduce risks and improve your health span. In summary, advanced baseline measurements are precise and personalized. They help you tailor your fitness and health plan to address your specific goals and challenges, ensuring you are set up for success for your aging journey. Whether you're working on cardiovascular fitness, muscular strength, core stability, these tests will give you information to make real progress. Now you've mastered the basics, this is all about advancing your fitness and health journey. If you already mastered the basics, like the beginning level strength and balance assessments, this is going to be the next step. Think about shifting from your general fitness advice to precise training. Advanced baseline measurements are like having a GPS for your health. They provide detailed, actionable data to refine your strategies, maximize your potential for aging gracefully. These tests allows you to personalize your health. Your results will reveal where you are excelling and where you need to have more attentional focus. This kind of targeted approach ensures that every step of you take are aligned with your specific needs. No more guessing, just clear data decisions to help you age in the healthiest way possible. And this is why you used your week one material. What do you want to accomplish for the rest of your life? This is going to also help guide your training program. For your homework, I encourage you to try to do some of these tests on your own. If any of these measurements seem intimidating or unfamiliar, don't worry. we will be doing the beginning versions of these ones in our week 3 session. But if you want to have professional guidance and have any specific concerns, we can involve your doctor, get an order for physical therapy, so I can safely guide you through the process, get the results, and guide you through developing your program for you. Remember, the goal is to empower you with tools and knowledge, not to overwhelm you. I do recommend Peter Tia has great podcasts from the drive. Episodes 307 206 are focusing on baseline measurements and trying to uh, guide you for exercise plan and reduce risks and improve your health span. In summary, advanced baseline measurements are precise and personalized. They help you tailor your fitness and health plan to address your specific goals and challenges, ensuring you are set up for success for your aging journey. Whether you're working on cardiovascular fitness, muscular strength, core stability, these tests will give you information to make real progress. Now you've mastered the basics, this is all about advancing your fitness and health journey. If you already mastered the basics, like the beginning level strength and balance assessments, this is going to be the next step. Think about shifting from your general fitness advice to precise training. Advanced baseline measurements are like having a GPS for your health. They provide detailed, actionable data to refine your strategies, maximize your potential for aging gracefully. These tests allows you to personalize your health. Your results will reveal where you are excelling and where you need to have more attentional focus. This kind of targeted approach ensures that every step of you take are aligned with your specific needs. No more guessing, just clear data decisions to help you age in the healthiest way possible. And this is why you used your week 1 material. What do you want to accomplish for the rest of your... For those who do not know me, my name is Matt. I'm the physical therapist at GL Rehabilitation since the end of 2020. This helps me provide for my wife and 3 kids. And throughout this process, I started off my journey being born and raised on a dairy farm in western Wisconsin called Prescott. I stayed living on the farm to attend the University of Wisconsin River Falls, and I obtained a certification of exercise sports science, and with the certification of exercise physiology specialist. Then I went to University of Wisconsin-Madison for my doctorate of physical therapy, and while I was there, I obtained my certification in strength and conditioning specialist. After that, I obtained and did my residency in orthopedics at UW Health in Merida, and I got the chance to sit for the orthopedics clinical specialist. So I know it looks like I have a lot of alphabet soup at the end of my name. I just wanted to demonstrate and share how passionate I am for helping others. And this is the whole point of why I want to further my education and keep on learning to help my patients get the best care that they deserve. Alright, so this is going to be an extra PowerPoint. It's the advanced baseline measurements. So same concepts. We have some baseline measurements I want you to master first, and these are just additional things to take to the next level. So I always have to make sure you're aware. These are general exercise guidelines and advice. Please use your discretion. Please be safe. We're going to go through the PAR Q that is going to see if you're ready for exercise or if you need medical clearance before you do that. So that is going to be an important aspect of this, because GL Rehab and myself cannot be liable for any actions that are taken based on this information. So please be safe, because that is the utmost priority. Alright, so this is going to be an extra PowerPoint. It's the advanced baseline measurements.
8 weeks ago, we started a journey.
Concepts.
And
we have
over these years,
some baseline measurements I want you to master first, and these are just additional things to take to the next level.
Let me remind you what we accomplished.
I always have to make sure you're aware. These are general exercise guidelines
and the strength
and advice.
Among the strongest predictors of how well
discretion. Please be safe.
Week 4,
we're going to go through
we installed the engine.
PAR Q
we learned about zone 2.
That is going to see if you're ready for exercise or if you need
and my cardiovascular system
clearance before you
is
do
the
that. So that
delivery
is going to be
system
an
that powers
important aspect
everything.
of this.
Week 5,
Because
we added
geo
steering,
rehab and
brakes, and
myself
suspension,
cannot be liable
stability
for
and
any
mobility,
actions that
the systems that keep you
are
safe and
taken based on
functional.
this information.
In
So
week
please be
6,
safe, because that is the
we took the
utmost
car
priority.
in for a full suspension, head to toe,
Alright,
from
so
your
this is
feet to
going
your
to be
brain.
an extra PowerPoint.
In last
It's the
week, in week
advanced
7,
baseline
you
measurements.
planned the road trip.
So
you learned how to structure a
concepts.
periodization
Some baseline
training
measurements I
plan
want you to
that
master
puts it
first,
all
and these
on
are just
the
additional
4 pillars
things
together.
to take to the next level.
Now you have a strong car, you
I always
built
have to
a
make
strong
sure
engine,
you're aware. These are
a
general
precise
exercise
handling,
guidelines
and have a good
advice.
plan. That's fantastic.
Please
But here's a
use
question
your
I want
discretion.
you to
Please
sit
be
with.
safe.
How do you
We're gonna
know
go
if the
through
car is actually
the
performing the
PAR-Q
way you think it
that
is?
is gonna
How do
see if you're
you
ready for
know your
exercise or if you
engine
need
is not overheating?
medical
How do you know your
clearance
brakes
before you do
is
that?
not
So
going
that
to be
is going to
having
be
wear
an
thin?
important aspect of
How
this.
do you know your
Because
fuel
geo rehab
efficiency
and
is
myself
improving?
cannot be liable
You need
for
a
any
dashboard.
actions that
You
are
need
taken
gauges.
based on
You need
this
sensors,
information. So please be safe, because that is the utmost priority.
roundouts, and readouts. This is what today is all
Alright,
about.
so this is
Advanced
going to be
baseline
an
measurements are
extra
the
PowerPoint.
dashboard for
It's
your
the
body.
advanced
I tell you
baseline
with these numbers, with data,
So,
with precision,
same
exactly
concepts.
where
We
you
have
stand
some baseline
across
measurements I want
every
you to
domain
master
of
first, and
fitness.
these are just
And more
additional things
importantly,
to
they
take
tell
to the
you
next
where you
level.
need to focus your energy
So
on.
I always
In
have to
week
make
2,
sure
we
you're
ran
aware.
some of
These are
the
general
first
exercise
versions of these, more the
guidelines
beginning baseline
and
measurements.
advice.
Chair
Please
stands,
use
arm
your discretion.
curls,
Please be safe.
sit up and down chest, grip
We're gonna go
strength.
through the PAR-Q.
This is a
That
good
is
starting
gonna
point, but today
see
we're
if
going to
you're
level
ready
these up.
for exercise or if
We're
you
going to
need
introduce advanced
medical
tests.
clearance
These are going to
before you
give
do
high
that. So that is going
resolution
to be
data.
important
Think about
aspect of
upgrading
this.
your basic
Because geo rehab
dynamometer
and
for a full
myself cannot be liable for any
panel.
actions
So
that
let's get started. Let's go
so
back to
this
week
is
1
going
for a
to be an
moment. Remember when we asked you to think about your
PowerPoint.
marginal decade,
It's the
the
advanced
last decade of your
baseline
life,
measurements.
when you were
So
still
same
physically
concepts. We
active,
have some baseline
roughly
measurements
the
I want you to
ages
master
of
first, and these are just
80,
additional
90, or
things to
80,
take to the next
85 to
level.
95, depending on your trajectory.
So I
I
always
want to
have to
ask
make
you to
sure
write
you're
down the
aware.
activities.
These are general
And these are going to be
exercise
what you're going to do
guidelines
during that decade.
and advice.
Hiking with grandchildren, traveling independently,
Please use your
getting off the
discretion.
floor
Please
without
be
help,
safe.
carrying your groceries.
We're going to go
Today,
through
every single
the
test we
PAR-Q
discuss connects
that is
directly
going
to these
to see
activities.
if you're ready for exercise
This is
or if
not
you need
abstract.
medical
This is a
clearance
personal.
before you do that. So that is
VO2
going to be
max tells
an
you where
important
you're
aspect
going
of this.
to, how well you're going to walk through the airport
myself
without a
cannot be
wheelchair,
liable for any
whether you need
actions
to
that
climb a flight of
are
stairs
taken based on this
without
information.
stopping,
So please be
whether
safe, because
you
that
can
is
keep
the
up with your
utmost
5-year-old
priority.
at the park. Peter Tia calls out the VO2
so
max
this is
as the
going to be
single
an
most
extra
powerful
PowerPoint.
predictor of
It's
longevity.
the advanced
Each
baseline
one
measurements.
met
So
improves your
same
cardiovascular
concepts.
fitness,
We have some baseline
reduces
measurements
the
I
risk
want you to
from
master
dying
first,
to about
and these are just additional
13%.
things to
This is
take to the next
enormous.
level.
Grip strength test and dead hang
I always have to
time
make sure you're
also
aware.
tells you if
These
you
are
can carry your
general
groceries, opening a
exercise
jar,
guidelines
holding
and advice.
on a rail firmly,
Please
or pushing
use your
yourself
discretion. Please
up on
be
the
safe.
floor. Research shows you
We're
that
gonna go
grip
through
strength
the PAR-Q
in
that is
midlife
gonna
predicts your
see if
disability
you're ready
status
for
25 years
exercise or if you
later.
need
25
medical
years later.
clearance before you
That
do that.
means
So that is going to
what
be
you should
an
do.
important aspect of this.
That means
Because
what you
geo rehab
do
and myself cannot be
today
liable
with
for
your
any
hands
actions
affects
that
whether you're going
are
to
taken
be
based on
dressed
this
when you're
information.
85.
So please be safe,
The
because
Y
that
balance
is the
test, the core
utmost
stability
priority.
screens. These are all fall prevention gauges.
Alright, so this is going to be
Falls
an
are the number one
extra
causes of
PowerPoint.
death
It's the
in the
advanced
adults
baseline
over
measurements.
65. Not
So,
heart attacks, not
same
cancer, falls.
concepts. We have some
These
baseline measurements I
tests
want you to master first,
tells
and these
us
are just
whether
additional
your balance
things
system
to
has gaps
take to the next
and
level.
can improve on.
So
And
I always have to make sure
these
you're
tests
aware. These are
are
general
powerful.
exercise guidelines.
There's hopping,
and
there's jumping,
advice.
there's line drills.
Please
These
use
measures
discretion. Please
your
be
fast
safe.
twitch muscle fibers.
We're gonna
The
go
ones that
through
we catch yourself when you fall.
PAR-Q. That is
The
gonna
ones that will let
see
you
if you're
react
ready for
to a
exercise
dog
or if you
when
need
it lunges out at you or
clearance
tries to chase
before
a
you do
squirrel.
that. So that is going to be
These
important
fibers
aspect of
decline
this.
2 to 3
Because
times faster than your
geo rehab and
tortuous
myself
fibers
cannot be
as you
liable for
age.
any actions
If you're
that
not testing them, you do
are
not
taken
know
based
how
on
they are
this
disappearing.
information. So please be
today
safe because that
is
is the
about connecting the
utmost
dots.
priority.
Every test has a purpose. Every number
Alright,
tells a
so this
story
is going
about
to be an
your
extra
future,
PowerPoint.
and the
It's the
story
advanced
is one you can
baseline
change.
measurements. Alright, this is where it all comes together. I've created a powerful tool to help track the progress and tailor your training in the beginning and advanced line basement measurement sheet. Whether you're just starting out or already active and looking to take things up a notch, these sheets offer a clear, measurable way to see where you're at and where you're going. Each version includes dozens of tests that cover every aspect of physical aging: strength, endurance, mobility, balance, power, and more. The best part, we've created a comprehensive over 150-page document that walks you through all of it, how to complete it, what the score means, how to compare to others in your age. Also, you'll find tracking sheets that improvement in plans. You can scan the QR code on the slide or visit our website at aginggracefully.com to purchase and download the guide. Think of this as your personal aging roadmap, customized to you. Retest regularly, make adjustments, and stay on track as you age with strength and intention.
Then you walk through the 5 domains of advanced baseline measurements. Think about these as the 5 gauges on your dashboard. First, cardiovascular fitness. This is your speedometer and your fuel gauge combined. We measure this with VO2 max, the max amount of oxygen in your body can use during intense exercise. In week 4, we talked all about this, what it means. Peter T. calls it the most single important metric for longevity. Today, we'll talk about how to measure it a little bit more precisely than what we did in week 2, using running baseline running test, or even the rockboard walking test, or even going to DexaFit Madison for an actual VO2 max test. Second, strength. This is your horsepower of your engine. We use 10 rep max testing across compound movements: squats, deadlifts, overhead press, chin up, power ups. These are the same lifts we used in Lift More study. We're not going to go in depth about it because we're not going to capture them today. They're going to be in the master PowerPoint, so feel free to look at the YouTube video for that, or the course archive. We're just going to be mentioning that it's being a part of the testing. It shows that high intensity resistance training improved bone density even in postmenopausal women with osteoporosis. We also test isometric endurance with the wall sit test, dead hang, farmer carry, air squats. These tell us how long your muscles can sustain effort under load, which is exactly what real life demands. Third, stability and mobility. This is your suspension and alignment system. The Y balance test measures dynamic balance and identifies asymmetries between your left and right sides. The core stability screen, the dead bug, the bird dog, planks, Pallof press, evaluates the deep core stabilizers. We first talk about in week 5. Each exercise has a scoring system with a set of points and progression levels, so you can track improvements over time. Fourth, power and agility. This is your acceleration and brakes. Jumping and hopping tests your fast twitch muscle fibers, the ones that fire when you need to quickly react, catch yourself on the curb, dodge an obstacle, react to a grand and run towards you. These fibers decline 2 to 3 times faster than your slow twitch fibers with aging. So if you're not measuring them, you do not know if they're disappearing. Fifth, and this all ties everything together, your overall functional profile. When you combine data from the 4 domains, you'll get a complete picture, not just scores on a test, but also stability and stable, not just endurance, but also explosive. This comprehensive view is exactly what you get Aging Gracefully 102 tracks. Over time, hopefully you'll see those 5 pillars increase, or hopefully keep maintaining as we're getting older.
So why are these tests important? Cardiovascular fitness reflects how efficiently your heart, lungs, and cardiovascular system delivers oxygen to your body during sustained physical activity. This is important for all of us, but it is becoming especially critical as we age. Maintaining strong cardiovascular health can reduce your risk of chronic diseases like heart disease, diabetes, and strokes. In addition, staying active and improving your cardiovascular fitness is linked to mental health benefits, reducing anxiety, stress, depression, promoting better cognitive function is all important for everything from running errands to playing with grandkids and becoming more enjoyable. So, first and foremost, there are a few different types of tests that we can do to estimate your VO2 max. True test is going to be a VO2 max, and that involves a metabolic cart, and it takes some more detailed testing, and but we can estimate it based on these tests. So first, and these go in order from intensities. So the 6-minute walk test is where you assess how far you can briskly walk in 6 minutes. It's especially good for seniors, and it's low impact. Then the Rockport walking test, which involves walking at a brisk mile and then measuring your heart rate, and then based on your how far you travel and what your heart rate is, it estimates your VO2 max. And then the next two are running tests. That higher level test that involves running 12 minutes or a mile and a half. Before we begin, it is critical that everyone understands safety precautions associated with these tests. If you have any concerns about your heart health or fitness level, please check in with your healthcare provider before attempting any of these measurements. As a reminder, always listen to your body. If you feel uncomfortable at any point, please stop immediately. Your safety is the number one priority. Now, alright everyone, so now we understand the test. Now, let's go from what are the results of these tests. So don't have to worry about memorizing any formulas or anything. We'll have it all in the notes for you. So let's look at the 6-minute walk test. So to be in a good category, it's 550 meters or over 1,600 feet for the best outcomes. And anyone under 400 meters or 1,300 feet is below average and may be high risk for cardiovascular issues. Now, next is going to be the Rockport walking test. After you finish the test and you take your pulse, use the formula in the notes to estimate your VO2 max. If you're a man and your VO2 max is over 42, or you're a woman and it is over 36, you're in excellent shape. Now moving on to the Cooper 12-minute run. If you can run more than 2,800 meters as a man or 2,300 meters as a woman, you're considered excellent shape. If it falls below this, it is a cue to start incorporating more cardiovascular training into your routine. And now the Cooper 1.5-mile run. Now, finishing under 10.5 minutes for a man and under 12 minutes for a woman is a result of a excellent cardiovascular shape. Now, these numbers can give you a snapshot of your progress. Ideally, aim for benchmarks somewhere 1 or 2 decades below your age. Then you'll be in the right zone. So strive for the highest category and then keep going one more decade below that, trying to see if you can accomplish this. And again, for all the procedures and detailed scoring assessments and using formulas, whyexercise.com, they have lots of different resources that you can use. The last test is going to be the 2-minute step test. a remarkably simple yet effective tool for assessing cardiovascular fitness and lower body strength. This test is particularly valuable because it can be performed anywhere, requiring no special equipment, and is suitable for people of all ages and fitness levels. Let me walk through why this test is so important. As we age, our ability to perform activities often depends on cardiovascular endurance and lower body strength. This test gives us valuable information about both these aspects of fitness. The beauty of this test lies in its simplicity. You simply march in place for 2 minutes, lifting your knees to about the halfway part between your knee and your hip. It sounds straightforward. It provides a critical data about your functional fitness level. And here what makes it so unique. Unlike complex gym equipment or elaborate fitness assessments, this mimics what we do every day, like climbing the stairs, stepping over obstacles. This makes it particularly relevant for evaluating real world fitness levels. This test is highly adaptable. If you're concerned about balance, you can perform this near a wall or a sturdy chair for support. This accessibility makes it an excellent choice for people of all ability levels. I want to emphasize the importance. It's not about the number, it's about understanding your current fitness level and setting realistic goals for improvement. The normative data I've provided gives you a framework to understand where you compare to your others in your age group. But remember, the most important comparison is with yourself and previous performances. Look at your normative data I've shared. You notice that the expected number of steps varies by age and gender. This is perfectly normal. As you're getting older, it's going to go down a little bit. That's why it's represented in the table. And knowing that our goal is trying to slowly work from the below average to the average to above average, and then going from that next age group from there. And these are just a way help to track your fitness, but also your little goals as well. Remember, try to warm up a little bit before the test. We'll make sure we're safe during the test. Remember to maintain good posture, breathe regularly, and stop if you have any discomfort. The test should challenge but never cause pain. You're gonna probably feel some like muscle burning, maybe some huffing and a puffing while you're doing this, and it's totally fine to have that, and that's kind of the goal of measuring cardiovascular fitness. And from there, we actually can measure and estimate some other VO2 max measurements. Now, let's break down some estimations of your VO2 max from your scores. And here gets really interesting. The relationship between the steps and your VO2 max is kind of broken down, and you can actually help correlate this to some activities you normally do. So if you can achieve 65 to 75 steps in 2 minutes, you're at the level that supports basic activities like preparing light meals, self-care. Pushing that up to 76 to 90 steps, you're looking more comfortably grocery shopping, doing light housework. But bringing that up to 91 to 105, you're in the sweet spot enjoying activities like social dancing and water aerobics. Here's the exciting spot. If you can manage all the way up to 106 to 120 steps, you're obtaining more activities like swimming, hiking, even tennis. This is where the real impact of cardiovascular impact is. So those things, as you can mention, they're estimating your VO2 max at those specific levels. So let's take a tip that many people overlook. We're not just reaching for these numbers, it is maintaining them consistently. Regular testing helps us track progress, adjust fitness routines accordingly. I recommend monthly assessments to keep tabs on how things are going. Remember the test is an exercise, so might as well add this to a monthly routine to just add this into to keep track of these numbers. These numbers are not just things on the slide. These are things that indicators of how well your ability to live life fully and independently. Each step you take in this test represents the capacity of your daily life, from playing with grandchildren to traveling and pursuing hobbies. Again, safety is paramount. Always make sure you have good pacing throughout this process. And this is the fun part. You can always view this as, oh, I'm in this 65 category. Let's aim for the next one. So next month, trying to slowly keep adding up. And it's a good way to shoot for your goals. Finally, I just want to emphasize these are standards, not guidelines, not rigid rules. Everyone's fitness journey is unique, and success looks different for each person. The key is consistency and improvement over time, no matter what your starting spot is. And as I mentioned, we have Why Exercise on here. I reached out to him and he's able to give you breakdowns of the 6-minute walk test and the Rockport. I have some in my presentation notes, but I do encourage visiting his website to dive more in depth about these topics of the other two tests. So we just spent a lot of time on testing of VO2 max, but why is it so important? In simple terms, VO2 max is the max rate of oxygen consumption your body can handle during exercise. It is a direct reflection on how well your heart, lungs, and muscles work all together. Keep you moving beyond its role of fitness. VO2 max is a powerful indicator of overall health. And a higher VO2 max means you have a lower risks for developing chronic diseases and lower risk of mortality over time. Let's look at the charts. Why Exercise has a wonderful website, and they kind of have great figures of having your different age categories, and has different categories of where you fall within that. And from there, it allows you to figure out if you are in the poor versus all the way in the highest and elite levels of it. This is where we talked about trying to aim for your being in that superior category and then trying to go for 1 or 2 decades below where your actual age is. So, as lastly, don't forget to check out Rob Carl. He's a PT and he's the one that made this images, and I shared the video with him during our first session of Why Exercise. He is a PT doing the same message, trying to promote healthy living and aging gracefully through exercise. He has great resources, so please check him out. He is more than willing to help you guys out, and has lots of videos along the way to help you understand.
The estimation test we just covered, the 6-minute walk test, Rockport walking test. These are solid twos. They give you the ballpark, but I want to be honest with you, they can be off by 10 to 20%. Coffee, hydration, sleep, all of these can affect your heart rate and skew the results. It's useful, yes. Precise, not exactly. If you want the real number, the definitive clinical grade measurement, there's only one way to do it, is a lab-based VO2 max test and using a metabolic cart. Peter Attia calls the gold standard, and I'm excited to tell you we have partnered with DexaFit Madison to make it accessible to our community. Here's how it works. You get on a treadmill or a bike. The protocol is customized to you. Walkers walk, runners run. Intensity increases gradually until you hit your max effort. The whole time your face mass is connected to a metabolic cart, measures every breath. Oxygen in, carbon dioxide out in real time. What you can get back is your true VO2 max score if you push yourself hard enough, which is quite difficult. You have veterinary thresholds and individual training zones based on your physiologically, not just 220 minus your age. We talked about how that is not an accurate measure for you guys. DexaFit Madison often offers 2 tests that are paired beautifully with this. A DEXA scan is a body composition scan, scanning your bone density, lean mass, body fat, visceral fat, all the numbers we discussed in week 2. And they have a new advanced movement assessment, which analyzes their functional movements, identifying compensations, asymmetries, and generates a corrective exercise plan. As a physical therapist, I can tell you it's kind of objective data that's incredibly valuable. Here's the deal for our community. All three tests are bundled for $329. That is $95 off of the $424 retail price. And Jessica, one of the owners, have confirmed the rate is ongoing. So you can do the test now, repeat in 3 to 6 months or a year. I recommend a year, and do these yearly and pay the same rate every time. That's before and after comparison is what the real power comparison and tracking trends over time is the real magic here. For individual tests, the code using the code Aging 220 gets you 20% off. One note: the movement assessment is currently on the west side only, on Junction Road in Mass, and the east side in Sun Prairie is coming. That QR code on the slide takes you to a private booking page built just for our participants. The discounted price is already built in. Contact information on the slide as well. This is completely optional, but if you want precise data, you want to truly get personalized training and plan around it, this is a great way to do it. Let me know if you have any questions. You can contact Jessica or myself if you're interested.
So let's talk about VO2 max and its importance of biomarker for longevity. VO2 max is one of the most reliable indicators of both how long you'll live, your lifespan, and how healthy and functional you will remain as you age, known as health span. Here's what makes it such a powerful biomarker. VO2 max integrates several systems in your body: your heart, your lungs, your muscle, your circulation, all work together to support your physical activity. To put it simply, the higher your VO2 max, the better your health will be. But there's a catch. VO2 max does not change quickly. It's a long-term metric, meaning that getting from a low levels to elite levels take consistent training over years. This makes it a reliable indicator of your cumulative efforts towards a better outcome. There's no cheating for the exam. You have to put in the work to get a better result. The graph here is from Peter Thiel's podcast, and he does a great job of demonstrating how VO2 max declines as you age for everyone. What's important to note is people who remain at higher levels and then continue to perform demanding activities. For instance, the green curve shows those of the 95 percentile can still run a 10 miles per hour, while the red curve highlights they are facing many struggling at basic tasks of walking. So that is very telling. Here's why it gets interesting. While everyone's VO2 max declines, those at a higher starting levels maintain the ability to do more for longer. That is the essential why you have to build VO2 max early in life. In summary, achieving and maintaining a high VO2 max is one of the best things you can do for your longevity and health span. It doesn't mean living longer, it means living with more mobility, energy, and independence. So keep aiming for high levels of VO2 max, and you'll invest in a better quality of life for decades to come. Now let's look at how we evaluate strength on a deeper level. These tests form the core of our advanced strength assessment and give a full body picture of how strong and resilient you are. We starting with 10 rep max testing for the squat, deadlift, overhead press, and then the pull up or chin ups. These aren't just any lifts. These are based on the Lift More study, and they've proven to improve bone density, more importantly, improve that functional capacity as one gets older. So these are great exercises to do. Then we have more like isometric tests, like the wall sit, the air squat. Um, how long and how low can you go? We have dead hanging. These measures how long your muscles can stay engaged under pressure. Importantly, important for both injury prevention and day-to-day stamina. Finally, we have the farmer's carry, arguably the most real-world strength test. If you can carry a heavy object and still walk with control, you're aging well. We'll break down to each one of these in a few slides. We'll learn how to test them safely, interpret the results, and build your plan to get stronger over time. 10 rep max or 10 RM testing is a practical and effective way to measure strength across major muscle groups. To test, we will provide a clear benchmark for your strength levels and serve as a guide for setting training intensities. It's also a great way to track progress and stay motivated. The purpose and exercises. During the sessions, we will focus on 4 key exercises: the front or back squat, deadlift, overhead press, and chin-ups or pull-ups. These exercises target the most important muscle groups, including your legs, backs, arms, shoulders. These are kind of dove in from the Lift More study aimed on targeting bone health for osteoporosis and improving your bone density. So that's kind of where these also came from. So by the end of today, you'll know the maximum weight you can safely and effectively lift for 10 repetitions with proper form. Here's how we conduct the test. Start off with a warm-up using light weights to prepare your muscles. Gradually increase the load in small increments until you find a weight that challenges you for exactly 10 repetitions while maintaining good technique. Take 2 to 3 minutes of rest between each attempt to ensure full recovery. Stop at the heaviest load where you can complete 10 clean reps. Safety is our topmost priority. Before attempting these tests, it is essential to have at least 2 to 3 months of consistent weight training experience. This ensures you have a solid foundation and familiar with the technical demands of these lifts. If you are new to the gym, start with lighter weights and focus on mastering form before attempting the 10 RM tests. Form cues for each lift. The front back squat. Keep your chest upright, core engaged, your knees tucked, and knees track over your toes. More importantly, your second or first or second toe. Avoid rounding the back or letting your heels lift up or your knees come in. Deadlift. Keep your bar close to your body, chest up, shoulders back. Avoid jerking the bar, rounding the back. Overhead press. Maintain a neutral spine. Press the bar overhead in a straight line. Avoid arching your back or flaring your elbows. Chin-ups or pull-ups. Start from a dead hang or pull-up until your chin clears the bar. Control the descent and avoid using momentum. Once we establish your 10 RMs for each lift, we'll use that data to tailor your strength program. For example, your training sessions might include lifting at 70 to 85% of your 10 RM. We'll also retest every 4 to 6 weeks to measure progress and adjust your program as needed. Remember, these tests aren't just about the numbers, they are about understanding your capabilities and identifying areas of improvement and settling realistic goals. By prioritizing technique and consistency, you'll build strength and confidence that extends well beyond the weight room. Let's talk about the weighted front or back squat, one of the most powerful tools for building and preserving lower body strength as we age. But to do it safely and effectively, we need to focus on technique first. Step 1 is spinal alignment, ribs over pelvis. This means avoiding a puffed out chest or an arched back. This keeps the spine in a stable under load position. Step 2 is breathing and bracing. Instead of sucking in your belly, expand your ribs laterally. and brace your core like it's in the full 360 degrees balloon. This protects the spine and helps you lift more safely. Step 3, engage your hips and your feet. Create a solid tripod with your feet by pressing your big toe, pinky toe, and heel into the ground. Gently open up your hips and knees more so they track more naturally. When doing all together the alignment, breathing, hip alignment, you can unlock the strength and confidence to squat without pain. And this translates to real life resilience. We'll assess this movement in class and teach you how to do it properly and safely. On this slide, we're looking at reference values for the back squat, 10 rep max or 10 RM. This is a useful tool. It reflects both muscle strength and endurance without requiring maximal effort like a 1 max rep test. These numbers are based on validated studies using a large sample sizes. As you can see, there's a clear distinction between trained and untrained individuals between age groups. For example, untrained males in their 20s might squat over 200 pounds for 10 reps, while trained women might manage 115, 125. For older adults in the 60s, the numbers are lower, but still impressive and achievable with consistent training. We also include definitions of training status so you can better self-identify where you fall. Your goal isn't to compare, but to understand what's typical and what's possible. These are benchmarks can help you track your progress and set realistic goals. Most importantly, always prioritize proper form and consistency over lifting too much and getting hurt. This slide covers everything you need to know to perform the deadlift safely and effectively as you age. There could be a whole presentation on this. It's a very complex movement. So I'm just trying to break it down a little bit for you. We are focused on the conventional deadlift with emphasizes the posterior chain, your glutes, your hamstrings, lower back. For some, especially those with mobility issues or longer limbs, the sumo deadlift might be more comfortable. Start by aligning the bar over the middle of your toes and your feet and gripping it just outside your legs. Your spine will stay neutral, not rounded. Your lats should be engaged by pulling on the bar tight to your shins. As you lift, you think about driving your hips forward and leading with your chest. The bar should travel straight up, close to your body. At the top, stand tall, don't lean, don't back shrug. We all talk about how often to train, usually once or twice a week is enough, how to avoid common mistakes like rounding the back, rising too early, deadlifts. Deadlifting with good form helps preserve muscle mass, protecting the spine and support independence as you grow older. There's some other things. You can have some equipment to help foster enjoyment while this, as well as those QR codes on 2 YouTube videos that kind of discuss and dive into this even more in depthly. I encourage you guys, if you're serious about this, to watch the videos before you try to deadlift. This slide presents normative data for the deadlift across age and sex groups. These values are based on estimated 10 rep max, roughly 75% of your 1 rep max. You'll notice that as we age, the standards shift down, which is a normal part of aging. However, maintaining strength is in this movement is essential. It helps with real-world tasks like lifting, laundry, picking up grandkids, and loading groceries. Use the tables as guidelines. If you're not deadlifting around the good or excellent category for your age, that's okay. It's a target to work towards. So this is like goal setting is a huge aspect of this and keep you motivated. But remember, proper form and safety are the utmost priority more than the numbers. Always lift with a flat back, brace core, avoid rounding your spine as we age. It's not just about lifting heavy, it's about lifting smart. We have to stay in the game of exercise and movement as long as we can to maintain that consistency. Also, your strength level also affects your strength levels also affects by diet, sleep, training history, consistency. So don't get discouraged. This is a long game, and play the long game of your life, and your body will respond consistently with your training at any age. Now we're diving into one of the most fundamental upper body lifts, the overhead press. This movement not only builds shoulder strength but also maintains postural integrity and core control, which are critical as we age. The main muscles involved are your anterior delts, upper traps, triceps, upper chest. When setting up, making sure the bar is at armpit height on the rack. Use a grip that is just wider than shoulder width apart, and keep your feet about shoulder width apart. When you press, drive the bar straight above the head, not forward, and brace your core and glutes. Avoid common errors like shrugging the shoulders or cutting the range of motion short. If you're just starting out, dumbbells might be more natural. Just make sure you are controlling the motion. Remember, the standing versions challenges your core more, while seated allows you to do heavier loads. Alternate between them as needed, and be patient. Overhead press builds strength gradually, but the benefits and stability and functions are tremendous. So making sure we're not overdoing it. Again, we're playing the long game. Make sure you can. There's a YouTube video that helps walk you through the different forms as well. So feel free to scan the QR code. Let's take a moment to look at the normative overhead press strength data by age and sex. These charts help us understand how we compare to the typical performance standards based on training experience. The data assumes we're doing a strict standing barbell press, no leg drive, full range of motion, proper posture. As expected, strength declines with age, but good news is that training even just 3 to 9 months, you can move someone from the untrained to the novice or even the intermediate category. For example, a 60-year-old man pressing 80 pounds is performing quite well for his age. These benchmarks are useful for goal setting, but remember, individual factors like mobility, injury history, arm length affect results. What matters most is progression over time, not just how you compare to others. The overhead press is essential important as we age. It builds shoulder strength, tricep, and postural strength while demanding core stability. These are essential qualities for daily living, reaching overhead, carrying groceries, or playing with grandchildren. The takeaway here: strength is trainable at any age. Use the standards as motivation to keep moving forward, one rep at a time. Now let's talk about pull-ups. The movement is a powerhouse when it comes to building upper body strength, especially in the lats, biceps, and core. Unlike machines, pull-ups challenge the entire body, requiring strength and control from head to toe. To do it properly, use overhand grip about 1.5 times your shoulder width. Hang on to hang on with your arms straight and shoulders active, and pull with your elbows down and back. Your chin should clear the bar, ideally touching your upper chest. Lower under control, keeping your body rigid. For those who can't get up to do bodyweight pull-ups yet, don't worry. Use a band, partner, or assisted machines to build the strength progressively, avoiding swinging and hand repping. The goal is full range and control. If grip fatigue limits you, use lifting straps occasionally, but also work on grip strength exercises separately. Over time, mastering this skill pays off. Better posture, stronger shoulders, and improved real-world function. Even one pull-up is an achievement to celebrate. Here we're looking at normative data for the strict pull-up, broken down by age and training status for both men and women. These values are derived from the military fitness standards, collegiate data, and large population assessments. Pull-ups performance is a powerful indicator of upper body strength, scapular control, and grip strength, all key components of maintaining function as we age. Notice that performance naturally declines with age, but even modest training can significantly improve scores. Improving and moving from untrained to novice, from novice to intermediate, represents meaningful strength gains. For those unable to perform a pull-up, we, we recommend assisted variations or lat pull downs while building the necessary strength and control. Keep in mind these scores assume proper form, no swinging, no kicking, full range of motion, and a controlled tempo. In older adults, prioritizing body weight pull-ups strength can delay frailty and improve independence. It's not about achieving advanced status, it's about tracking improvement and functionality over time. This slide introduces the wall sit hold, a fundamental strength test and training tool that is highly relevant for the aging gracefully population. It is an isometric exercise, meaning you hold the position without moving, which helps build muscular endurance in the glutes, the quads, the hamstrings, the core. These muscles are essential for walking, standing upright, preventing falls. Using a resistance band above the knees, we can cue the body to activate the glutes and maintain proper knee alignment even more to prevent any knee discomfort and pain. Your thighs will be burning, but it should not be joint discomfort in the knees. Preventing common age-related issues like the inward collapse of the knee. The goal is to sit like you're in a chair, flat against the back, flat against the wall, knees at 90 degrees, back, hips back, spine neutral, core engaged. And the fun thing is, it's very scalable. You can go down like and do a half hold or a mini hold, and slowly work up from there. And these are just going to be starting off with like 10 seconds. Eventually, the goal is going to be a minute, and you can say this is going to be like the kind of the time you're striving for. But you can take 1 or 2 decades below you if you're doing good, or if don't get discouraged if you're not at that decade because it's very trainable. We want to track how long you're holding good position, not just struggling and having bad form. So let's go on. So this is going to hopefully fuel your lower body strengthening isometric tests. Now that we've mastered the wall set, the next progression is the air squat hold, an essential movement for aging adults. This position trains the glutes, hamstrings, hips without the wall support, which makes it more challenging for balance and core stability. It is especially useful for tasks we do daily, like standing up from a chair, lifting, maintaining postures, picking things off the ground. Start by standing just wider than shoulder width apart with toes forward, maybe slightly outwards. Hinge at the hips like you're sitting in the chair, keeping your back upright and your spine neutral. The resistance band can encourage you to keep that glute activated. Press your knees outward and imagine splitting the ground with your feet. Hold the position around 90 degrees at your hold 90 degrees of knee angle. Avoid rounding your back or letting your knees cave inward. Start with 10 seconds and aim up all the way to a minute. And this thing is that you're gonna have to be tracking how far you go down, as well as how long you can hold, so you can be very objective with your data. And guess what? The time for the wall sit and the air squat are exactly the same. So I'm not going to put that information there because just go back one slide and you can look at that data. And that's going to be the goal. This exercise doesn't just build muscle, it trains endurance for real life movement and helps us reduce for falls. And remembers, form matters more than time. If form breaks, stop and reset. Quality first, then duration. The farmer carry is one of the most underrated yet powerful exercises we can use as we age. Think of walking with purpose under load, a movement that challenges your grip, strengthens your core, teaches your body how to move upright with control. That's vital, especially when we're talking about carrying things like groceries, laundry, or even supporting a partner. It is simple but fundamental. Standing tall, tightening the core, walking while holding dumbbells. This training training balance, posture, and strengthening all at once. What makes the movement so valuable it is that it reinforces good habits. Stable shoulders, aligned spine, strong grip, and engaged breathing. If posture breaks down, it tells us where our weaknesses are and gives us a way to fix them. We start basic, but later we can progress to single arm carries with a suitcase carry on even loads to further challenge our body's ability to resist twisting or collapsing under load. This is aging gracefully in action, strong, steady, and fundamental. Now let's talk about the dead hang. It's an incredibly simple yet powerful tool and training method. You can hang from a bar using your overhand grip, underhand grip, have your arms bent, have your arms straight. The goal is to hang on as long as possible with good form. It's not just about grip strength. It's incredibly important and linked to better health and longevity. It also helps decompress your spine, improve your posture, and build shoulder control and stability. There are two main variations: a passive hang while you remain fully relaxed, and an active hang where you lightly engage your shoulders. Both are useful depending on your goal. It is If it's too challenging at first, you can modify with bands, short durations, or partial assistance. A strong grip and stable shoulders help us stay independent as we age, whether it's carrying groceries or just holding ourselves upright. So the simple test gives us a lot of insightful and beneficial information. Now that we understand the purpose and benefit of the dead hang, now let's talk about actually doing it and what is good score looks like. I've linked a fantastic YouTube tutorial here, but it gives a clear visual on how to safely get into the hanging position, engage the shoulders, and hold good form and posture throughout. Once you're confident with the technique, you can begin testing your hold time. This chart shows general benchmarks by age and gender. They're they are just goals, not requirements. So don't be discouraged if you fall below. These are something you can absolutely train and improve with consistency. For example, if you're 60 years old, holding 40 seconds is great. If you're 80, even 20 to 30 seconds can be a strong indicator of grip strength. As you improve, your ability to carry, stabilize, and even prevent falls also improves. Remember, start slow, use support as needed, and always prioritize form over duration. Progress will come for sure. Just keep at it. Think of stability as the foundation of a house. If the foundation is weak, everything else becomes unstable and prone to collapse. Similarly, our body's stability underpins everything we do, from walking and reaching to more complex activities like running or lifting weights. Let's talk about why stability is so important as we age. First, it's a key factor in preventing falls. Falls can lead to fractures or other injuries, which often cause long recovery times, which can significantly impact quality of life. Secondly, stability ensures our bodies moves efficiently. When all parts are working together, we save energy and reduce the strain on individual muscles and joints. This not only improves performance, but also helps prevent overuse injuries. Lastly, stability supports longevity in activity. Whether you're playing with grandchildren or pursuing a hobby, maintaining good stability ensures you can keep doing what you love safely and confidently. To measure stability, we use a mix of dynamic and static tests. The Y balance test your ability to maintain balance while standing on one leg while reaching in different directions. It's a great spot to spot imbalances between the left and right sides or identifying restricted mobility. Imagine reaching forward to the side behind you. This mimics real life movements where stability is critical, like stepping over an obstacle, catching your balance when you trip. The core stability screening includes exercises like the dead bug, where you lie on your back and extend opposite arms and legs while keeping your core engaged. This tests your ability to stabilize your trunk during movement. The dead bug, similar concept but performed on your hands and knees, which challenges your pelvic and lumbar control. Planks, both on your elbows and on your sides, which measures the endurance of your core stabilizers. And finally, the peel-off press, which uses resistance to test your ability to resist rotational forces. This is especially important for activities that require twisting and turning, like picking up groceries or playing sports. By measuring stability, we can identify and address weaknesses before they lead into falls or injuries. It's a proactive way to maintain independence and improve overall quality of life. So as you move forward in your training, remember stability isn't just a starting point. It's a key to aging gracefully and starts active and staying active for years to come. The Y balance test is one of the best tools we have to assess dynamic balance, how well we can stabilize ourselves while reaching or moving. Why this is important for aging? Because daily tasks like reaching into the cupboard, catching yourself from a trip, all require coordinated movements, balance, and core control. We use this test to look for imbalances between the left and right side of the body, which can reveal underlying strength and control issues that often go unnoticed. For instance, an asymmetry in forward reach of just 4 centimeters is enough to predict a significant higher fall and injury risk. The test is easy to set up. Just the tape on the floor, and all you need to do is your own body. During the test, you'll be balancing on one leg, reaching with the other in 3 directions: forward, backwards and in, and backwards and out. You'll lightly tap the floor on your farthest reach. We'll score you based on your leg strength, based on the adaptability to. Uh, we'll adapt this based on your leg length, because that's important. Because that's gonna be it's gonna be different for everyone if their legs are different. In our Aging Gracefully class, we'll use this as a baseline to track improvement in our balance, strength, and control. Key areas we'll target throughout the program. Let's dive into the comprehensive assessment of the core and strength stability. This assessment is critical for understanding the individual's core stability, which plays a fundamental role in physical health and injury prevention. The core includes muscles such as the abdominals, obliques, lower back, hip flexors, which are all support everyday movements we make. Whether it's walking, bending, lifting objects, strong core leads to better balance and stability, which are essential for maintaining independence, especially as we age. These exercises also require a high level of body awareness and proprioception, the ability to sense where one's body is in space. Improving one's body awareness allows individuals to move more effectively and safely, reducing risk of falls and other injuries. Exercises like the bird dog side planks engage multiple muscle groups at once, improving not only muscle strength but also coordination. Breathing control is another important aspect of these exercises. Proper breath control helps maintain core stability and maintain intra-abdominal pressure, which protects the spine and improves overall performance. Learning how to integrate breathing with movement also benefits cardiovascular and endurance. A key focus on these exercises is spinal stability. Maintaining a neutral spine during movements helps prevent back pain and injury, ensuring the vertebrae and discs remain well supported over time. Good posture and spinal stability are essential for long-term musculoskeletal health. These exercises are mimic functional movements that are essential for the day tasks of carrying, bending, lifting. By strengthening and testing these movements, individuals can perform everyday tasks more easily and with less risk of injuries, helping them stay independent as long as they age. An added benefit of these exercises is that they are scalable. Individuals can start at a level that matches their ability, and as their strength improves, they can continuously make it harder. And they don't require a lot of equipment. They are accessible for everyone, regardless of their fitness level or setting. Ultimately, by focusing on your core stability, we're not only improving strength and balance, but we're also supporting everyday life with movement patterns and enhancing quality of life. A strong core makes everything from bending down to tie your shoes to reaching overhead much easier and safer. Let's now talk about how to know when to progress your core stability exercises. Whether you're doing holds like a plank or repetitions like the arm and leg movements, is key is consistency and control. For holds, wait until you can perform 2 sets of 60 seconds with relatively ease without shaking, sagging, or holding your breath. For reps or pulses, aim for 2 sets of 20 slow or 40 pulses reps with great form before advancing. The system doesn't allow for half points. That's because each level builds on stability and posture and core endurance for the next. Skipping ahead might set you up for injury or compensations in ways that lead people for chronic pain. And here's why it matters. A strong, well-controlled core improves balance, walking, and protects the spine. It's what helps you stand tall, catch yourself when you trip, and stay independent as long as you age. By progressing throughout thoughtfully, you're investing in your long-term mobility and resilience. Let's take a look at the fundamental breathing pattern we screen in our Aging Gracefully program. Diaphragmatically breathing. This test looks simple but reveals a lot. Why does it matter? Your abdominals and pelvic floor. It stabilizes your spine and posture during movement. When we begin by teaching people to lay flat, place a hand on their chest and belly, and breathe in for 2 seconds, out for 4 seconds throughout the nose through nasal breathing. The goal is to minimize chest movement. Breath should expand in your belly and lower ribs. As you can As control improves, we place hands at the waist and encourages a 360-degree expansion. And then we gradually increase our breath timing to a 5-10-5 cycle. Finally, we test our ability to hold our breath after the exhale for 20 seconds, an indicator of good CO2 tolerance and stress resilience. This is scored using a point system to show readiness for progression. Mastery here sets the stage for improved balance, spinal support, and stress control, all essential for aging well. The dead bug is one of the most important core stability screens in the Aging Gracefully program. Why? Because the challenge is not just strength, but coordination, breathing, and control. Key ingredients for resist a key ingredient for a resilient spine and strong posture. We start for a neutral spine, ball between hands and knees, and proper abdominal bracing. From here, we layer complexity slowly, from lifting one limb and one arm to holding a 990 position, all all of the way to moving opposite arms and opposite limbs without losing form. Breathing is a secret here. It's powerful. Exhaling during the movement, coming towards your back together, and inhaling as you're moving away, engages deep core muscles and reduces the chance of compensating with the chest and neck. For the second level, 2 points for proper posture, uh, 5 for good breathing control with movement, and 2 point progression per progressive level. This system makes it easy to track progress and catch plateaus. Mastering these patterns helps improve balance, posture, and even how confidently you move day to day. It is not just exercise, it's about building a stable foundation for aging well. Here's the value of testing as we age gracefully is the dead bug with the shoulder flexion. While laying down with your knees and hips at 90-90, you'll raise your arms and slowly lower your arms overhead. The goal is to keep everything as stable, no arching your back, no flaring your ribs, no moving your legs. Why do we care? Because this is simple motion tests three big things: shoulder mobility, core control, and your ability to move without compensations. These are all critical for daily tasks like putting on a shirt, lifting objects, and catching yourself during a fall. You'll record how close your hands get to the floor and use that as a baseline. Then we'll reassess after a few weeks. If it's tough at first, that's okay. We'll work on your mobility and core activation exercises to help you improve. This movement isn't just about strength or flexibility, it shows you how your body works as a whole. And that's a key in aging gracefully, with control, confidence, and function. Now let's walk through the bird dog screen. This is a key movement we use to test and build core stability. We start with a quadruped on hands and knees position with spine in neutral position, and we cue the shoulders to separate without rounding the back. Then we activate the core by drawing the belly button towards the spine, engaging deep abdominal muscles. Breathing plays a major role here. Each lift is paired with a 4-second exhale and a 2-second inhale in return, ensuring the stability and the parasympathetic control. We progress through increasing challenging stages, from simple arm movements to leg movements to full uh, contralateral movements where you're doing opposite movements, mimics cross-body movements like walking. Each level builds coordination, balance, and spinal control. Mastering this test improves not just your posture, but the ability to move with control, especially as you age. And reminder, you only move forward if you complete the level with full ease and control. Now we're going to review one of the most fundamental core stability tests, the front plank. A strong core is a key to aging gracefully. It protects our spine, supports balance, and makes everyday tasks safer and easier. We begin with a simple knee plank, holding it for 30 seconds. From there, we introduce movements like lifting the leg to challenge control without letting our back sag or hips rotate. As we progress through toe planks and eventually unstable surfaces, we're testing not just strength but also endurance and stability, just like what's needed for walking on uneven ground and recovering from a trip. The goal here is quality, not quantity, or how long we can hold it. It's about breath control, spine in neutral position, and smooth movement are signs of good control. This grade system helps us assess your starting point and show measurable progress as your strength improves. And remember, even small improvements in your plank can translate into big gains for real life function and falls prevention. Let's talk, let's talk about the side plank and why it's important for aging gracefully. This screen tests our stability laterally, meaning resisting side-to-side movements that challenge our balance and alignment as we move. The setup begins with a bent knee version to make it accessible for everyone. We'll focus on core engagement, drawing the belly button in and tucked under the pelvis slightly. As we progress through the levels, we add holds, leg lifts, pulses, and eventually move to full toe planks and unstable surfaces. These variations challenge your obliques, glutes, and spinal stabilizers more deeply. What what does that mean for everyday life? Better balance, safer walking, and protection from falls. Many people forget how essential lateral core strength is. It keeps us upright when we trip, prevents us from doing the penguin walk going back and forth when we're walking, helps us carry groceries, navigating stairs. This is one of the most fundamental, relevant movements we can screen to train for older adults and just in general population. This screen uses the Pallof press to assess anti-rotational core strength, which is essential for everyday movement like spinal protection. The goal here isn't to rotate, it is to resist rotation, a key uh, function in our deep core muscles. We start by pressing the band forward and slowly, then increase complexity by adding pulses, narrowing the base of support. Each level trains the body to stay strong and aligned under increasing challenges. This matters uh, This matters deeply for aging gracefully. When we walk, when we twist, carry, and even stand, our spinal and core work consistently, preventing excessive movements. Poor core stability can lead to back pain, poor posture, and increase the risk of falls. And as we get older, our back tends to not like to rotate because of it. And this is a weak link. So this is a great way. It's more of an isometric exercise where you're not moving and doing these exercises. So you're training your rotation muscles without actually rotating, which is that's a very great way to ease into rotating again. Research shows that core training enhances balance and protects the spine in older adults. Mastering the Pallof press progression not only builds strength in the rotational plane, it builds resilience and independence. Remember, only move to the next level when you can complete 2 sets of a solid form and control for 60 seconds. This isn't about speed, it's about control and quantity. Here we have a summary table of the 6 core screen that includes in the program. Each one is broken down by the number of points of the setup, how many levels it has, includes, and how many total points available. These exercises target not only the abdominal muscles, but also helps the hips, spinal stabilizers, and even breathing patterns. The more levels an exercise has, the more opportunity there is for progression and challenges. Our goal is not just to do these exercises, but to master each level with good form before progressing. By using this point system, we are able to track growth, find areas for improvement, and maintain motivation. Core strength is essential to balance, posture, and injury prevention, and it becomes even more important as we are aging gracefully. Let's talk about the deep squat depth test. This is one of the most telling and fundamental assessments we can use. With feet slightly wider than shoulder width apart, toes slightly turned out, we'll squat as low as possible while keeping your heels down and your spine upright and straight. Try it with and without your arms for support. This lets us see whether it is balance or joint mobility that needs work. Why is it important? The depth squat keeps us gives us a snapshot of ankle, knee, hip, and spine mobility, essential joints for every task like toileting, picking up something off the floor, or getting upright from the ground. It also challenges your balance, core strength, and coordination. Even small improvements in depth can mean huge gains in daily function and reduce falls risk. We'll measure how far your butt is from the floor and track this over time. If it is limited, don't worry. There are great exercises we can prescribe to help you improve mobility, strength, and control. Mastering the squat is a big step of aging gracefully and staying independent. Before jumping into any testing or impact-based activities, we prepare the body. Think of this as a warm-up before the workout. We start the deep squats and then the deep squats with toe raises to build baseline strength and joint mobility, especially at the hips, knees, and ankles. Then we moved into small, soft jumps, focusing on control landings for the few sessions. Then we track the number of contacts, aiming for 50 to 60 to avoid overload. Once we feel comfortable, we challenge the body with directional movements, forward, backwards, and side to side, while using resistance band if needed for support the knee. As we progress over a couple weeks, we introduce rapid fire jumps to train quickness and coordination. Finally, we work in single leg jumps, which are key for balance, power, and preparing the body for running. This jumping progression not only helps you avoid injury, but builds a foundation for lifelong strength, agility, and movement confidence, all essential for aging gracefully. This next highlights the most accessible and powerful way of training balance, control, and reactive strength: line jumps. The goal here is twofold. First, we start with slow version, focus on control by sticking the landing after each jump. This ensures safe biomechanics and strengthens the muscles involved in balance. After two consistent weeks, participants can progress to the rapid fire version, where we can test how many quick, clean jumps can be performed in 30 seconds. We use both double and single leg variations, forward and backwards and side to side, to target different planes of movement and challenge the body ability to stay coordinated under fatigue. This type of drill is essential for aging because it mimics real life demands: catching yourself from a trip, stepping too quickly to the side, or regaining balance. It's scalable, measurable, and deeply fundamental. Just a line on the floor can become a very powerful tool to build fall resistant agility and cardiovascular resilience. And remember, gracefully aging doesn't mean slowing down, it means moving well with confidence. Now let's talk about the line jump test, one of the most powerful and simple tools we use to track explosive leg power, balance, and quickness. Skills that are critical for aging well. This test involves jumping over a line back and forth for 30 seconds. It can be done with both single or one leg. Now, we provide age and gender specific goals. For example, if someone is in their 50s, a good score might be 50 jumps. These numbers help you see where you stand and what you aim for. Why is it important? As we age, we naturally lose muscle power and coordination, which are key reasons for falls and reduced mobility. Training this kind of rapid movement keeps your nervous system sharp and your legs strong. You'll want to land softly, breathe rhythmically, and gradually progress to more difficult variations, the single leg hops and lateral jumps. Remember, it's not just hitting the numbers, it's about maintaining the power and ability to live boldly and move freely as we age. This movement, the max vertical jump, is not just for athletes, it's actually a powerful tool for preserving lower body strength and reaction time, especially as we age. The goal isn't necessarily to jump higher, but to train explosive strength and controlled landings, which are critical for preventing falls and staying mobile. We start by focusing on the landing, jumping moderately and holding the landing for 1 or 2 seconds. This builds joint control and prevents knee collapse. After about 2 weeks of mastering that, then we move on to full effort jumps. These jumps start fast arm swings and quickly squat the body. Then the full body launch up. It is important to land softly, absorb the impact through the hips and knees, and avoid drifting. Over time, this builds power, balance, and confidence. As we age, we lose fast twitch fibers that help us react quickly. Practicing movements like this helps keep natural pathways strong and support our ability to move dynamically in daily life. Vertical jump isn't just for athletes, it is one of the best real world indicators of low body power and reaction time. These are vital as we age. The quick burst of energy helps catch you from falling to climbing the stairs with ease, or even playing with your grandkids. This is just what we're talking about. We start by mastering these basics, stick the landing first. Once a solid, then we move on to more explosive jumps, keeping the knees aligned, core tight, and moving your arms to generate more momentum. These charts show what's typical and for different age groups and gender. If you're in your 60s, you're jumping 35 inches might seem far off, but a 1 or 2 improvement can translate into a major real world benefits. We use these numbers to help set goals, not just compare ourselves to others, but to track our growth. The key is for aging gracefully, staying strong, staying mobile, and continuing to challenge our body's limits safely. Now we're progressing to the single leg vertical jump, a dynamic test that challenges both power and stability. This is more than just an athletic movement, it reflects how well we can control one side of our body at a time, which is essential for daily functions like walking and preventing falls. The first step is developing control, landing softly on the same leg you jumped from without wobbling. This is the foundation. Once you can consistently stick the landing, then you're ready to build up to full explosive jumps. During the test, we compare your reached height to how high you can jump for one leg. And then we look at the difference side to side. Because even a 10% asymmetry can increase your risk for imbalance and injury. This test helps us set realistic personal goals and guides your next steps in your training. If you can jump higher or land more quietly a few weeks from now, we are aging gracefully in the best way, with control, power, and resilience. Now let's talk about the standing broad jump, a simple but powerful way to test lower body explosive strength. This test gives us an insight on how much force you can produce from your hips and legs, an ability that naturally declines as we age, but is critical for maintaining independence. Also, it's testing that generation, but also how you to put on the brakes and slowly controlling that landing. To perform, to stand behind a line, bend your knees, swing your arms, and jump forward, landing with both feet. We measure from the starting point to the back of your heel. We'll take the best of 2 or 3 jumps. What makes this important isn't just how far you jump, but it tells what it tells us. It helps us identify lower body power, balance, and coordination, as well as that stopping ability when you're landing. Can you put on the brakes really quickly? Because that's going to help prevent us from having injuries. So sticking landing is going to be key. And this controlled strength are key for getting out of a chair, climbing stairs, catching yourself when you trip. We also look at your form. Soft landings with knees aligned are critical to protect your joints and avoid injury. This is a great measurement to practice and improve. Even small gains in jump distance show meaningful improvements in mobility and function. This slide highlights one of the most powerful indicators of functional age, the horizontal jump or broad jump. As we age, we lose power faster than we lose strength or endurance, and the power is the critical for preventing falls, staying mobile, and performing everyday activities with ease. This test, whether using two legs or one, lets us measure not only leg strength but also balance, coordination, and symmetry. Notice the age and specific gender-specific benchmarks. These help us set individual goals, track progress over time, and spot issues like strength imbalances. The limb symmetry index helps identify asymmetries that may increase falls and injury risk. Proper form and safety setup are critical. We use this test both as an assessment and a motivational tool. It shows clients how their training translates into real performance and improvements, and more importantly, independence. Improving just by 5 to 10 centimeters can be a difference between struggling with the stairs and bounding up them quickly. So, jumping isn't just for athletes, it's for everyone to age gracefully. Now that we built strong in coordination, we're progressing into the triple hop for distance, an advanced test for lower body power, control, and balance. Participants hop 3 times forward on one leg and must stick the landing for the 3 seconds. We measure the total distance from the starting line to the back of the heel. This test mimics real life situations, like quickly regaining balance from a trip and a step unevenly. It is especially valuable for identifying asymmetries between legs and falls risk and reactive strength, all critical for aging adults. Remember, the goal isn't just distance, it's safe, controlled power. Arms can be used freely, but always consistently across tests. If someone can perform these tests with competence, it is a great sign of athletic aging. We're going over this slowly in class, and we'll build it up with simpler test progressions to ensure safety and confidence before trying the full test. Now we move into the max distance triple hop. Participants perform 3 forward hops with one leg or double leg, depending on the variation. We do both, aiming for the distance and trying to compare side to side. The key here is not how far you go, but how well you can control your landing, stable, and symmetry between both legs. This is where the limb symmetry index comes in. By comparing performance to age and gender-based norms, we can set realistic, personalized goals. These norms can help track improvement and detect asymmetries that might increase your risk for falls. Why does it matter? Because explosive power is lost and one of the first and fastest to decline in aging. Faster even than strength. Improving this test improves the bodies to react quickly, stay confident on your feet, and protect against falls. It isn't just a test, it's a gateway to maintaining independence, bone health, and a higher quality of life as we age. Now let's look at the triple crossover hop for distance test, a dynamic and functional test that challenges our balance, coordination, leg power in multiple planes of movement. In this test, the participant hops diagonally over the center line 3 times using the same leg, landing solidly after the third hop and holding the landing for at least 2 seconds. It isn't just for athletes, this mimics real life movements like trying to grab something, stepping over an obstacle, regaining your footing. The crossover element demands more control and ability than the straight ahead jumping. And we're also doing the double leg, not really based on research, but this is going to be kind of a good way to do the double leg first, so you get comfortable with it, and then you can do the single leg. We're not just measuring jump distance, we're assessing your body's ability to control motion dynamically. This is a huge implications for reducing fall risk and improving real life function. And the best part, the test you can train for and improve over time, which makes it a perfect goal setting and progress tracking on your training for aging gracefully. The max distance crossover triple jump is a great and powerful indicator of strength. We're using this to help set meaningful goals based on your age and gender. We can see how you're doing, and you might aim for over time. Maybe you're already in the good range. Maybe you're already starting below average, and you want to improve. Either way, the jump highlights specific areas like leg strength, trunk control that we can target in training. We also look at left versus right performance to detect asymmetries, which often show up before someone gets hurt. So not only is it a good goal setting tool, but is a preventative health screen. If you're working on balance, lower body power, and recovering from injury, this jump helps us guide your journey towards staying strong, stable, and independent as we age. So that wraps up all the baseline measurements that we will be con- collecting. I do have a sheet of paper that you can write all your scores down. You can take that home and you complete it as you need and you want. Next week's session, we will be trying to go through and measure a lot of these things with you. But make sure you are cleared by and cleared and you're good to go with your exercise. I don't have any injuries or risk with this. If you feel like you will qualify or you need to have a one-on-one session because you have an injury or you have any kind of difficulties doing activities that you normally like to do throughout your day-to-day tasks, that does qualify you for physical therapy. There'll be a sign-up sheet in the back, as well as you can scan this QR code, and that will bring you to a spot where you can start the process of having physical therapy. It has been a pleasure uh, uh, during the second session with you. I'm looking forward to hopefully many more sessions with you guys. Last thing before we go, this is going to be Zach Bush's information about trying to do a little exercise throughout the day. And it's only 4 minute bite-sized chunks. So feel free to watch him. And if we run out of time, we're going to have you try to do this by yourself and watch this video.